Hello and welcome. This is your program, Familycore, and today we'll be discussing COVID-19 and underlying conditions. With me in the studio is a consultant pathologist who is going to x-ray this topic with me. You definitely have been hearing a lot about COVID-19 being more dangerous in patients with underlying conditions or people who have underlying conditions being more liable to die from COVID-19. I have somebody who is capable of taking this topic today. Stay tuned. Welcome back. Now I introduce to you Dr. Orah. Is a consultant pathologist and is going to be taking this topic. Dr. Orah, please. Welcome.
Thank you very much. My pleasure to be back again.
Now, generally, what do we mean when we say underlying conditions, particularly as it relates to COVID-19?
When you say underlying conditions, you refer to someone, in medical terms, a patient who has usually a chronic illness and has also now contacted the virus COVID-19. A chronic illness is an illness that a patient has had for quite a long period of time. It hasn't killed the patient, but the patient is treating it. An example is diabetes, hypertension, cancer. There are a lot of lung diseases like bronchiectasis, bronchitis, emphysema. These are, long-term conditions, even asthma. These are diseases that you don't cure. It's not like there's a cure for it, but you treat the patient's symptoms and you help the patient live a normal quality of life.
Okay, so that's underlying illnesses.
Yeah.
So why do we need to know about underlying illnesses?
Yes, with respect to COVID-19, certain underlying illnesses predispose a patient who has, or somebody who has contacted this virus to more severe symptoms, more debilitating symptoms, and may actually predispose this person to actually dying from this virus. These are chronic diseases or conditions that are centered in the lungs, heart. It could even be, may not even be a disease as it were. For example, obesity. People that are really, I don't want to use the word fat because using fat is body shaming. Obesity is more related to your body mass index, not just that you're big. Yeah, so people that are obese, it's not like it's a disease, but it impairs your bodily functions. It impairs, these chronic conditions can impair your body immunity, can impair the way your body responds to this virus, the way your body fights this virus. It's important to know these conditions as well because it may also affect the kind of treatment you can receive for the virus and the kind of therapy that should be given to you in certain cases.
There are two parts I want to clarify.
Yes.
That's about the maybe complications or the problems that can come because the person now has COVID-19. He had chronic condition before, now he has COVID-19.
Yes.
Or is it that they are also more liable to contract the illness?
For example, taking the first category
Yeah.
you mentioned. Now, there are people that, for example, you have a lung condition. For example, you have COPD, chronic obstructive pulmonary disease, okay. Or you have asthma, maybe severe asthma. These already impair your ability as a person to breathe in and to breathe out, to have normal lung volumes, to fully expand your lungs, as it were. Now, COVID is a virus that targets the lungs. Okay. People with COVID find out that they have a lot of pulmonary edema, or what we call water in the lungs. And it stops you from being able to breathe normally or breathe fully. Now, in a person that has COPD and is now superimposed, and COVID is now superimposed, it's almost like you're carrying
insult upon injury.
Insult upon injury. You're carrying some weights, and then somebody comes and doubles the weight that you're carrying already. It's more difficult even then. So somebody that is already struggling to breathe on a daily basis now has more difficulty in breathing. So usually those kind of patients or those kind of people have more severe symptoms. You also talked about the second category of people that are more likely to contact the virus. Now, that category, you talk about immunocompromised patients. By immunocompromised, I mean your immune system, which is the body system that fights off infecting or invading agents, is not able to function optimally. So you find immunocompromised patients like those with HIV/AIDS, those with cancer. Cancer can suppress your immune system in many ways, either through the drugs you're taking, or perhaps through the cancerous cells themselves invading the bone marrow. So your immune system can be low in those instances. Certain diabetic patients also have low immune system functions, and those certain congenital malformations predisposed to low immunity, for example, Down syndrome. These are those category of people that may be more likely to acquire the virus if unduly exposed.
It's been Familycore, and we've been discussing COVID-19 and underlying conditions with Dr. Orah. After this break, we'll take it from there. Please stay tuned.
For asymptomatic people, you don't show that, you just feel like you're fine. And a lot of people that are walking on the streets, because they sweat, they do everything, they don't even know that they might even have it. They think it's just malaria, and they go and take malaria drug. And some people feel that, okay, because the sun is an element that will, you will beat Shaggy out of the virus, So people just feel ill for a few days, and then it reacts differently to people. So whatever the case, if you see somebody who has cold, if you see somebody who reacts, you never can tell. All right, stay away from the person. If you are the one, it's best that you be careful. All right, you could have a very strong immune system. By God's grace, I had a strong immune system. So I got down. I think I was just down for about 3-4 days, and then that was it. All right, in as much as I stayed home, but that was it. Think about your family. Think about the people who cannot recover as fast as you. If you are asymptomatic, you pass it on to somebody that has underlying health issues. They catch it, they don't survive how many days, and then they die. So if you are, or if you think you're not feeling fine, it's better you just stay. Just take precautions, wear your mask. I think since then it has happened, I am very comfortable wearing my mask. You will never catch me. Before, every small time I put it down, except I want to eat. But right now, I don't joke with it. I walk around from morning till I wear the mask. I don't joke with it, right?
Welcome back. It's still Familycore, and with me in the studio is Dr. Orah. He's still around, and we're discussing COVID-19 and underlying conditions. Let's move to during this period that we have. We talk about social distancing, we talk about different things. How are these people that have chronic illnesses able to get health care from the hospital at this time? Is it the same way they've been able to get health care that they're getting it even now?
Well, it depends. It depends on whether their source of healthcare is the public or the private healthcare system.
Okay.
So I know that the private healthcare system have evolved ways of telemedicine, whereby patients like this have instant access to doctor. They don't have to come into the hospital, especially as they are high risk. So you don't want them coming into a hospital where, if they don't have the virus already, they could pick up the virus. And because there are different strains of the virus, and some are more virulent than others, they may pick up a very virulent strain of the virus. So telemedicine is one way that these people have been able, these high-risk individuals have been able to keep up with their health appointments with your doctor. The other way is that usually if any of these high-risk people are in an emergency, they are usually advised to visit the hospital, public hospital or private hospital, as soon as possible, regardless of their COVID-19 state, positive or negative. And the reason is that, for example, somebody who has high blood pressure, or let me say chronic obstructive pulmonary disease, which is the example I used initially, goes into a situation or a state where they're finding it hard to breathe, it's important that they get to the hospital as quickly as possible. And at the point of getting to the hospital, usually you have records if that's the hospital you've been using. And even when you don't have records, yourself or the person accompanying you to the hospital should be able to inform the attending physician or the doctor on duty at the time of your underlying medical conditions. In a situation where this person or these high-risk people have contacted the virus already and they're already positive, it is advised that they continue with their medications. However, they should have their medications reviewed by a competent medical personnel such that their medications are reviewed in the light of the new medications they're taking for the virus, are reviewed in light of the current symptoms they have. I've talked to a couple of people that have had the virus that were previously hypertensive, and the feedback I get from them is that they realized that even though they continued taking their medications, their blood pressure was dropping really low. They were almost becoming hypotensive. And after reviewing it with the doctor, they had to stop taking their medications for a while. So the lesson there is that, you have to review your medications with your doctor, and of course your doctor would, take some, will examine you, will take some measurements of you to know, okay, look, do I continue, do you reduce, do you increase? So it's important that they continue their medications, and of course do all the other things, social distancing, washing their hands, eating well as much as possible.
Okay, so this review can be done via telemedicine, right?
Can be done via telemedicine, of course, assuming that you have the facilities to make it work, but definitely can be done via telemedicine.
Okay, so I want you to take one or two of these underlying conditions and how it affects the prognosis of COVID-19. I mean, the chances of dying or making it of somebody that has COVID-19.
Yeah, so like I mentioned before, if there are chronic lung conditions or diseases, the lung is already threatened. The lung is not performing optimally. If someone is known to be asthmatic and has severe episodes of asthma, or someone is known to have certain lung diseases, your lungs are not operating optimally. In getting infected by COVID again, what it implies is that, like you said before, insult to injury. Your lungs are already pushing a lot of weight, and then you've added extra weight for your lungs to push. The way it looks like as a pathologist is, in the first instance, your lungs have a lot of, the word is scar tissue. It's like it's contracted. And then the second instance, when COVID comes on board, what we've noticed is a lot of pulmonary edema, like I said, water in the lungs. So it's almost like your lungs are contracted and now there's also water in them. So it's more difficult for you to breathe. Such patients end up usually being placed on ventilators, because what the ventilator does is that it takes over your work of breathing. So you're breathing through a machine because the lungs cannot perform their functions again. The other condition I would like to talk about is cancer.
Okay.
Cancer is not a death sentence. Many people live with it depending on the type of cancer you have. Well, one thing that cancer can do is that either through the cancerous cells themselves attacking your immune system, or the drugs you're taking attacking your immune system. They can reduce your ability to fight off infections. COVID is a virus. Your immune system may be able to handle it, but when the ability of your immune system has been hampered by either the drugs you're taking or the cancerous cells themselves, you may be unable to fight it off as much as you would have. And so you end up being infected, and you may end up having very severe symptoms of COVID.
So this is why it's very important for those with underlying conditions to be more careful.
Yes, more proactive, planning ahead. If you know you're going out, you think about the transport you're going to take. Are you going to go by public transport? How am I going to socially distance? Where am I going to? Is it going to be crowded? You don't just go to the hospitals at any time you want to. As much as possible, avoid contact with other people.
If you can have the option of telemedicine.
Exactly, you can have the option of telemedicine.
That will be one of the positive things that came from COVID-19 for medical practice, because we've been reluctant for so long. So can we have an explanation of what telemedicine is really?
Telemedicine is, telemedicine, and medicine via telecommunication, really. And it means having a doctor's visit without being physically in the presence of the doctor. So it's like you're doing a call through any media channel. Yeah. You can talk to your friend through any media channel. You can also talk to a doctor through that media channel. Now, there are some enhanced channels whereby the doctor is even able to do things like measure your blood pressure, check your temperature, do some form of superficial examination virtually. Usually you have to visit somewhere and go into a booth. And in that booth, all those things, can take place to a large extent. And if you have done imaging studies, for example, ultrasound, MRI, CT scan, those images can be uploaded. The doctor can have a look at it and, treat you or talk to you or manage you without you having to be physically in their presence.
As an executive member of Fajim Medicare Foundation, what role are you playing towards helping in this particular case of COVID-19 and underlying conditions?
Fajim Medicare Foundation was established, to bring not just healthcare but knowledge to people. And in the educational aspect of it, people need to know before they can do. And that's one thing I'm very passionate about. Letting people understand not just COVID, but other health conditions, understand why they fall sick, understand what to do when they fall sick, understand how to prevent getting ill or falling sick. And what I have discovered in my years of medical practice is that it's not every sickness that needs to have, a drug every time. People look for what's the drug I can take. There are many times you can prevent falling ill by simple things you can do, maintaining a clean environment, eating your fruits and vegetables, lifestyle changes, simple lifestyle changes. And for me, this is what I try to put across to people, so that I tell people about. You don't have to always be in the hospital or look for something to, even resting, stress. A lot of the diseases we see sometimes are just, stress. So my role in Fajim and what I've enjoyed doing is, passing across medical information, medical education, medical knowledge to people, and saying it in a way that I try to say it in a way that they can understand and they can practice.
What are the final words you want to give to our audience concerning COVID-19 and underlying conditions?
COVID-19 is here to stay for I don't know how long. It's important that if you have if anyone has underlying conditions, they manage it as much as possible by avoiding contact with other people as much as possible, observing the routine, social distancing, hand washing or hand hygiene, And if for any constantly, booking appointments with their doctors via telemedicine, and if by any chance they contract COVID, they shouldn't be afraid. They should review their conditions with the doctor, move into, whether quarantine, and then be able to actually take care of this thing, because there are certain situations where they may actually have more debilitating symptoms than other people. So they need to be aware of this and to take precautionary measures before then.
Thank you so much, Dr. Orah. It's been Familycore, and we've been discussing COVID-19 and underlying conditions with Dr. Orah. Dr. Orah, I thank you very much for coming, and we're hoping that next time we need you, you won't mind coming again.
It's been my
Thank
pleasure.
you so much for your time.
Thank you.
It's been Familycore, and we've been discussing COVID-19 and underlying conditions with Dr. Orah. I hope you've learned so much from it, and I'm hoping that you take all the lessons from this segment of the COVID-19 series. Stay tuned.
As far as this COVID-19 pandemic is concerned, is a major issue, and we can't finish talking about it. And especially if someone has underlying medical issue, medical problem, if someone is hypertensive, someone is diabetic, if someone is asthmatic. In fact, the asthmatic ones, because this virus is a respiratory virus, those who are asthmatic, the kind of fear, the kind of anxiety they are carrying around is so overwhelming, it's so enormous. Because I have a lot of them around me. They know that what if I contracted this virus, what will happen to me? Even without the virus, sometimes I have attacks. Someone even told me that in recent time, I had a very terrible attack, to the extent that I knew that it was an asthmatic attack, but the fear of if I been contracted with the virus was the major issue. So this has had a very huge impact on the mental well-being of the people. So to the extent that people are having threats to their well-being in the area by displaying some anxiety disorders. Some, even without anything, they are going breathless, despite the fact that they don't even have the virus in their system. They are going breathless. Some are saying that I'm having chest pain, I'm having chest tightness. Some are having frequency of urination. Some are even having diarrhea, because the rate at which their bowel movement is going is at an alarming rate. And eventually I had to tell them that what you are experiencing is anxiety. You just need to go and calm down. I won't even start you on any drug. I just need to talk to you, to psychoeducate you, so that you know that this thing doesn't have anything to do with the virus, that you don't have the virus. So how do you know? I said, I know that you are prone to being anxious because you have an underlying comorbidity. You are an elderly person, and because the elderly person, the immunity of an elderly person is almost always next to nothing. And to now make the matter worse, if you have underlying medical problem that you are taking certain drugs for, and certain drugs that you take can even deplete your immunity further, because most of these drugs are potential poison. We use them because the benefit outweighs the negative side effects. So in this sense, those who have developed, my message is to those who have developed anxiety, those who are having depressive symptoms because they have the underlying medical issues, just try as much as possible to be optimum in observing the preventive measures, the non-pharmacological preventive measures, and try as much as possible to be up to date with your medications. Don't, just because of what is going on, the fear of what is going on, skip your medication. And at the same time, try as much as possible to live within significant others, people that will give you information that will boost your mental well-being, not people that will give information that will make you to go down the drain further. So in this sense, there is no fear except the fear that we put ourselves in.
Welcome back. I'm sure you've enjoyed the program so far as much as I've enjoyed it. Today, I've learned so much about COVID-19 and underlying conditions. I'm hoping that you or somebody you know who has underlying health condition will take more care of themselves, be proactive so that they can be healthy and live a better life. Till I come your way again, stay blessed.